what was it that for you personally that said, I want to devote my life essentially to helping other people deal with their mental issues?
I think that for me, I honestly got pretty tired of hearing people say it's in your head.
Yeah.
And my response, began to be, yeah, duh, you're right.
That's the point, right? That's exactly the point. Yeah.
That's where it is.
Yeah.
I think for me, the excitement is not just helping the client that's in front of me, but the reason why I have a platform specifically, because I could just do therapy, right? I could just do therapy with my client and that be it. But the reason why I have this platform is because it's about the individuals who are not quite ready to address the fact that they're having some difficulties, or they have family members that they don't quite understand how to navigate, how to communicate, how to effectively, support and be there for them. So it's kind of like a 50-50 between the two of them. And I genuinely feel that every person on this planet deserves to live their lives to the fullest and be happy and satisfied with that life. Not compromise that life, not settle for that life, but genuinely be happy, about where their life lies. And we all have accommodations. Those of us that have high blood pressure, we take our high blood pressure medication to help balance that off. Those of us that, may have some form of physical disability, we put accommodations in place for that situation to be taken care of. If I have an injury on my ankle, which is causing me pain or causing me difficulty to walk around, and my mindset is one of defeat. If my mindset is one that I feel defeated, that I feel no motivation, that I don't feel supported, then where is that internal drive, which is only found internally, or energy or motivation to push and pull me to go to my rehab, to get dressed in the morning, to look at that scar on my ankle and see it as a beautiful thing, as a challenge instead of a struggle.
Yeah.
That's the mental part. And so my job is to come in kind of like a surgeon, but through my words and through me pointing out your words and areas, get you to think differently. That's a powerful thing.
What do you tell people that are hesitant to either admit that they may be struggling mentally with some issues, or people that know they're struggling, but they're hesitant to come to somebody like you? Like, what would you tell them about that?
I often like to use the example of a personal trainer, right? And so, a lot of us like to go to the gym, work out. We've had some level of interaction with a personal trainer or someone, right, that tries to guide us on how to healthy eat. You come to a therapist because we are your personal trainers for your minds. Yeah. We teach you how to use your brain, which is a very large organism that helps to regulate your whole body. We teach you how to use that brain to the best ability so that it can fire and act appropriately, so that it can heal the way you need to heal. And so number one, I try to use it as an example of just like anything you're training for, you have to get exposed to a professional in that area to teach you how to work past those things that you are weak at. The other piece that I try to inspire to focus, especially men, we want to really talk about that, is the fact that there is this societal umbrella that says that a man has to be strong. And there's this very stereotypical, look of what that man looks like and what strength is. There's this machismo, right? That men, no matter your culture, are put up against. If the idea is really to be strong for your family, strong for your community, strong for your environment, why would you allow something to implant itself, fester, grow, and then interfere with other areas of your life? Because that's what mental disparity does. That's what mental interruptions do. They interrupt our ability to feel positive about ourselves, to feel motivated, to love the way we want to live the way we want to, and to laugh the way we want to. And then the third piece, if I may add, is your therapist got to be right. The therapist that you go to see, you've got to vibe with that person. You have to feel comfortable with he or her, and you have to feel like they get you.